I'm Dr. Rochelle Tazib, and I wanted to take a few minutes to speak about a subject that I feel pretty strongly about, and wanted to just put some information out there about the topic. So, the topic is birth control pills. In most of our lives, birth control pills are just a normal part of life. Most women have been on them. If you go to the gynecologist, you have a complaint, usually you're given birth control pills, and many times it's not given for birth control. Some of the reasons birth control pills can be prescribed to women can be, for example, acne or even PMS, mood problems, PCOS, and such things. So they're very commonly prescribed, but many times when they're prescribed, we don't really know what we're taking. We have an idea, but we're not really, it's not explained to women what exactly are birth control pills. And I think it's important that we know it is in the information packet inside of birth control pills, but most girls don't really read that. They feel if the doctor is giving it to them, it's probably good for them, and they just go ahead and take it. So what are birth control pills? Birth control pills are synthetic hormones, so they're not natural hormones. They're synthetic hormones that are given to suppress our body from making its own hormones. So when we take a synthetic drug that's mimicking our own hormones, it blocks your hormone production, so your ovaries no longer make estrogen and progesterone, and your body is essentially in a state of menopause, and in that way it avoids pregnancy. And by blocking your hormones in conventional medicine, they feel that if you block the hormones, then you avoid perhaps maybe acne, because acne can be caused by hormone imbalance. Well, this can't be farther from the truth, because when you block female hormones, you actually worsen the root cause of the illness. We need our hormones for health and wellness. We need estrogen and progesterone to be vital, to be healthy. They are responsible for many of the things that we associate with youth. And so replacing them with the synthetic hormones does not correct the problem, because the synthetic estrogens and progestins that are used do not have the same effect as estrogen and progesterone in our body. In fact, many times they have opposite effects and severe side effects. So this is something that's really not explained to women. I think if they understand what it is that they're taking, and this is the same for any kind of birth control, it doesn't matter the brand. The brand can be different and the amounts of the synthetic hormone can be different, yet they are still synthetic hormones. And some of the effects, some of the side effects, and many of these are written inside of the description, but again, they're not explained to women that they should read this. It's really, what is not given is an informed consent of what it is you're taking. So one of the things they can do, one of the large things they can do, is they can create blood clots, and a blood clot can theoretically kill you, create a pulmonary embolism and kill you. Another thing that they could do is they can trigger autoimmune disease. Many of us may have a dormant gene for autoimmunity, like lupus or Hashimoto's or scleroderma, and this gene does not become active. There could be a trigger from the environment, for example, a toxic hormone such as a birth control pill, and that can turn on the gene, and the person can then have autoimmune disease. And this is again written in the description of the hormones. Another thing synthetic hormones can do is they can affect your adrenal glands negatively. They also increase something called sex hormone binding globulin, and this in turn lowers the rest of your hormones, such as testosterone. Another thing birth control pills can do is they cause candida and leaky gut. So when women are on birth control pills, usually they have an overgrowth of fungus and yeast in their stomach, and also leaky gut, and this in turn causes a whole slew of other problems, and such. So I just wanted to take this time to talk a little bit about some of the effects of birth control pills that are not really explained to us. There's a lot more to talk about, but this is just some food for thought. Next time someone offers you, oh, here, take this, it's never that simple. With a drug, it's never that simple. If you're offered a pharmaceutical, the benefits should truly outweigh the risks, and the risks should be explained to you in an informed consent. And that way you can best take care of yourself and your body. If you're suffering from things like PCOS or acne or hormone imbalance or premenstrual symptoms, that's because there are underlying problems, for example, such as leaky gut, such as imbalanced gut bacteria, such as nutritional deficiencies and toxins that are affecting your hormones. So stopping your body from producing hormones will not help us. And I have experienced all of this firsthand, so I have studied it in books and I've lived it. And I just wanted to share it with you. Thank you.